I always sound more impressive when people read things off of paper. So first, I wanted to thank you all for weathering the storm. Like the weather, this topic that no matter what, babies are born. You can't stop it from happening. Just like the weather, you can't stop the storms. And I'm thrilled to see such a great group of passionate people in the audience. So like Maxine said, part of the foundation's interest in this topic is to improve the health of women and children, to enhance the opportunity for vulnerable children to be born healthy in loving homes. And when I started at the foundation a couple years ago, I was meeting with some grantees, and one of those grantees was at a freestanding birthing center. And we were having the discussion about, what really impacts a woman's birthing experience? How do you go through the process in a stress-free environment? Because we know from the science that reducing stress in women helps improve birth outcomes. And so how could the foundation enhance that opportunity for women to have a choice, to seek out places that they felt comfortable, and that, was it safe? Was it, a good way to go down this path of freestanding birthing centers? And that's really how this question evolved, because we understand that there's a lot of passion in this area about where children should be born, whether it's safer in a hospital, should women have the opportunity to do it at home with a licensed nurse midwife, should they do them in freestanding birthing centers, what's the role of physician, nurse midwife, doula, et cetera. And so when we went to the research, we saw that it really hadn't been updated in about 30 years. And so it was a great opportunity for the foundation to make a small investment in this meeting. And like the Institute of Medicine, we don't have a stake in the outcome. We're here to learn just like everyone else. We're not pushing one way or the other. We just want to better understand the science so that it can inform the grant making that we do as a foundation. When I joined a couple of years ago, my boss, Dr. Gail Christopher, said, just find things that the foundation can make a difference in. There's a lot of things we know about the science around improving birth outcomes, but we still have horrible outcomes in this country. And so with the small investments that the foundation's able to make, go out, find ways that our money can make a difference, and report back. And so this is actually one of the first investments I made when I joined the foundation as a program officer. So I'm excited to hear the results, and wish you all luck. And it really was nice to see Maxine. As she said, we've had a long history, and she's really one of my heroes in the field. So thank you guys for having me.
Well, thank you so much, Patrick, and we're just really delighted to work with Kellogg. Kellogg has done so much in our communities, and we're just delighted. Joining us also for some formal welcoming remarks is my colleague and friend, Isadora Hare, who is who is with the Division of Healthy Start and Perinatal Services for the Maternal Child Health Bureau. And I really am so happy Isadora was here because, as you know, the federal government is closed today. So we expected to have a lot more of the HRSA people here, but many of them were not able to get out, and she was very determined to have HRSA represented I've known Isadora for quite some time, and I'm just very happy that she's here with us. So if you would please come and say a few words from the Maternal Child Health Bureau. Thank you, Isadora.